Thank you for staying with us. Well, we're talking about dental hygiene, and right now, without seeing a drill, I can actually hear a drill going, and I'm actually developing goosebumps. Shows you how afraid some people are of the dentist's chair, which means that if you don't want to sit in a dentist's chair, you have to take care of your teeth. So, how do you take care of your teeth? And is there any connection between dental health and your overall health? Dr. Abimbola Udushote is here to tell us all about that. She's a dental surgeon and General Secretary of the Association of Private Dental Practitioners of Nigeria. And she's a certified nutrition coach.
They go hand in hand.
Good morning, doctor.
Good morning. Good morning.
I'm sure you didn't pity me when I was talking about the drill and everything. So, well, if you don't take care of your teeth and you have to end up in the chair, it's entirely your fault.
And then you're going to hear the drill.
Well,
Feel it.
well, I think that unfortunately in Nigeria, a lot of people are just not aware enough. Because with dental health, oral care, anything that does with most of the things that will make you go through the drill is actually preventable. So when you're aware from childhood on how to take care of your teeth, then you have no reasons to actually go under the drill. You have no reason for us to give you injections in the mouth, which is another thing people are scared of, to remove your tooth.
Ooh, I love that bitter taste
of the injection.
When the injection, just one drop gets into your mouth.
Excuse me, who are you?
I don't know. I don't know, but it's true. It's bitter, but it's a nice kind of bitter.
Really?
Yes.
So a lot of people don't like the bitter taste.
Well,
are you an alien? Who likes bitter?
That's very strange. You said when we are aware from when we are very young.
Yes.
Unfortunately, a lot of young children are not taught early enough.
Yes.
About cleaning their teeth morning and night, night especially, so that they do not end up in the dentist's chair.
Yes.
From your experience, is that awareness getting better now?
Well, I think a lot of there's a lot of education going on, but in reality, I think a lot of younger children now, they know brush your teeth twice a day, but we're not seeing that in terms of people coming into their clinic. We always encourage that you bring your child as soon as they have teeth. They should have their first encounter with the dentist. Now, why at that age they have no fear of the dentist. They have no fear of the dentist yet.
They have no fear of anything.
Yes.
No, my little boy doesn't like an injection.
No, we're not giving them. What you're bringing them to do is to be aware that they need to take care of their teeth. They should, they come in, we're not giving any injections, we're probably not doing anything. They don't have anything anyway. But just to know that there's a place called this dental chair, have a familiarity with it. A lot of times when people come into the dentist, they're already in pain. So their first visit is associated with pain.
Painful.
Yes. So, but if people come in and, we're having more children coming for school visits, and we're doing more of school visits as well, going to school and introducing the dentist to them, the dental hygienist to them. But we also want them to come in and see that we're not so bad. The chair is, for a lot of people, for young ones, it's a fun thing to sit on.
Especially those who like bitter injections.
Let
me ask you, man.
Yes.
Well, we're talking about lifestyle around dental hygiene. And, one of the things that I said earlier is that, people come into a room and other people tend to just close their noses.
Okay.
A little.
Now, in such a case, what you're talking about is what we call halitosis.
Also known as mouth odor.
Yes, also known as mouth
say it
odor.
that way.
Yes. Now, there are several factors that causes that. When you have accumulation of plaque, if you don't brush well, now brushing is something that is taught. It's not something, if I don't know how to brush well, I can't teach my children how to brush well or brush properly. There's nothing wrong in using chewing stick, but you must use the chewing stick to clean your teeth. But a lot of people just chew on it. That is not cleaning your teeth. So if you don't clean your teeth well, you will have accumulation. Even if you clean your teeth well, there are parts of our teeth that still accumulate what we call calculus or tartar. This can only be removed by a dentist or a dental hygienist, what we call scaling and polishing. And if you've experienced that, you see they bring out some hard things from your teeth. Now, when that accumulates there, it can cause a mouth odor. Another thing that can cause a mouth odor is if you have a hole in your teeth. Food gets in there, you're not bringing it, it gets rotten, of course, it will bring a mouth odor. Another thing, which is quite common in our setting, is fasting. Yes.
Oh.
Fasting, we call it the fasting breath or morning breath. A lot of people have a bad odor when they wake up first in the morning before cleaning. If you've not drank water, you have a dry mouth, that can bring a odor. More complicated things can also be gut infection, lung infection, when you have a cold, when you have any kind of infection or illness around the throat can also bring a mouth odor. So,
but you talked about washing, the teeth the other time.
yes.
How about the tongue? There are those who also say that if you wash your teeth and not wash your tongue, that could also cause...
Well, the tongue naturally is self-cleansing. Even though, yes, the back of the tongue, if they are, for some reasons, some people accumulate things at the back of their tongue. And then when you brush it, and that definitely will help clean. But naturally, the tongue is self-cleansing.
Okay.
But when things accumulate at the back, maybe you eat some things. Now, there's some kind of food that you eat that stick to the teeth. Unfortunately, in our own environment, we eat a lot of carb heavy, the soft agege bread that we like, plantain, fried plantain, rice. They stick to the teeth. Bacteria works on it.
Should we not eat them?
You eat them and you brush. We don't even encourage brushing immediately after eating anymore. We encourage you eat all your food at the same time. Even the children that like the sweet, the sweet things. As much as we don't want you to eat the sweet things, but if you must eat them with your meal. It's not this idea of you're sipping Coke all the time or sipping a drink all the time, and you're bathing your teeth in sugar. We don't want that. We want you that if you want the soda or the sweet things, eat it with your meal. And after eating your meal, in the morning after brushing, at night before you go to bed, brush your teeth. And make sure there's nothing accumulating there.
How about, well, I'm sure you are wondering why you should have everything together. We'll come to you, who enjoys bitter taste. There are those who have this, almost like they can't stop the saliva from flowing in their mouth.
We all have saliva that flows in our mouth.
But this one is like...
The
and they're always spitting?
Yes, something like
that. In such cases, there are times when such happens. We see that in pregnant women, in some pregnant women.
Okay. Men don't get pregnant in Nigeria,
yes,
to the best of my knowledge.
Yes, that's why I said in some pregnant women. Even not all pregnant women spit. Some people, it is when they are irritated by something. Some people are easily irritated, so once that... I mean, I tell patients when they come in, especially when you've removed a tooth, and you tell them there's no blood in your mouth, swallow your saliva. And they keep saying, I can't swallow my saliva. Tell them, you swallow your saliva all the time. But now something has been done in your mouth. Somebody has put their hands in your mouth. And suddenly you feel irritated and you're thinking you need to be spitting out. But we swallow our saliva all the time. But some people just get easily irritated and then they just want to keep spitting out.
What are some of those lifestyle vulnerabilities that make us susceptible to all of some of these conditions?
Well, definitely our diet.
Oh God, not again.
Yes, whether we like it or not, our diet has a lot to do with a lot of things as it concerns us.
Such as?
Like I said, a diet full of sweet, processed carbohydrates is definitely not good for the teeth. Why? Because in our mouth, naturally, we have bacteria. When a baby is born, there is no bacteria. But within a week or two, the baby has the same bacteria in its mouth that the mother has. You know?
But we don't clean babies' mouths.
We don't, but they have the kind of bacteria the mother has.
But their mouths don't smell.
They don't smell because they drink milk. So they have no reason, it has no reason to smell. It has no reason to smell.
Let me ask you something. I'm going to come back to you. You know, you are a grandmother. And sometimes, you know, there are some issues. I'm just wondering how grandmothers have to cater for the little ones when, you know, I'm sure that some mothers are even just generally afraid to take their child to any hospital at the time. So I'm wondering what Dr. Odushote is saying here, that I have to bring the little baby in for some visit to someone who will be giving
Familiarization tour.
No, there is no family in the house.
The baby is not so little anymore by the time they have their first teeth.
Yeah.
Which comes on average by the time they're 7 to 9 months. So they're not so little anymore.
But that's still...
Yeah.
Okay. So what do you do to them when they come at 9 months?
We just look at their teeth. We give them the mirror to hold, and we put them on a chair, and we just look at that and see how their teeth, and educate their moms on how to care for that teeth. Because a lot of times they are growing these new teeth, their mothers don't know how to clean them. They are like, oh, should I just put my finger? So we teach them how to take care of the teeth.
Yes. How does a mother clean a baby's teeth?
Well, one of the things that we encourage, you can put the cotton wool or a clean face towel and just use that to clean the tongue, wipe the teeth. Okay. So you can do that with using your finger. There's actually some covers, finger brushes that you can use for babies. And there are toothbrushes because, of course, at that time is the time to introduce them to using the toothbrush. You really don't need toothpaste. At that age, you really don't need
just
toothbrushing. And then once they come in, we also put fluoride washes on the teeth at that time. That's the first time because we know that fluoride helps form stronger teeth, which makes it more immune to holes, having holes. The teeth become stronger when there's fluoride.
There was something that we used when we were young mothers. I think it was glycerin or borax or something.
Okay. Yeah, at
Am
that
I correct?
time, yes,
is there
glycerin.
Something like that?
Yes, glycerin.
Yes.
Glycerin. Well, there's no harm in using that. It has nothing, but there's no advantage either.
Okay.
Interesting.
You can just use a brush.
Oh, a brush.
You don't have to use any toothpaste with
it. There's something you spoke about before we came on air.
Yes.
And you guys were talking about, both of you were talking about some cosmetics that people put on the teeth.
Yes.
Turkey teeth.
Please tell me about that.
I saw that only this morning.
Because, you know, I've also seen a trend. You talk about that one, please, as well. But I've also seen a trend. Some people just want to put braces on their teeth for show.
Well, it is really not for show. I don't think an orthodontist, an orthodontist is the specialist that puts on the braces.
This is why I said that.
Yes.
Someone sees other people wearing it and just says, it looks nice. I like to wear one.
Well, I don't. That's why I said I don't see orthodontists just putting
it there for
fun. The thing
cosmetic.
there is something that person is not happy about.
Okay.
Especially when in Nigeria, unfortunately, we see a lot of adults putting on braces, but that's when they can afford it. There's something they were not happy about in their mouth, and over the years,
what we used to call shamuga.
It could be shamuga. It could even diastema. It is a thing of beauty here, but dentally, it is an aberration, and it should be closed.
Please define diastema.
The space, the gap between the teeth.
Tooth gap.
Yes. We see it as it's AG.
Just call it tooth gap.
Oh, can braces correct that?
Yes, it can. It can. When people have crooked teeth, they have one tooth in front of the other. There are people that maybe they cannot smile. Or maybe somebody had made fun of them and they cannot smile. So when they have the opportunity they want to correct it. Coming to turkey teeth, or what people have been going, well, not from, I don't think people have been going from Nigeria, but
Yet.
what we yes. What people have been going there to do, to reduce cost, they want to wear things what we call veneers and crown, so that they can have a beautiful smile. Now, what a veneer will do, it will cover the front of your teeth. So all of it will be even, white, the color you want.
Okay.
And so you have a beautiful smile. Unfortunately, I think the article, which I had read as well, was talking about how people were not aware that instead of veneers, they were doing crowns for them. Because in a crown, you actually shave down the tooth.
Yes.
So now they have no choice. Unlike a veneer where you just do a kind of covering in front of the teeth. So that is what people are doing. People want beautiful smile. That's what things like whitening we're seeing now. Even now in Nigeria, one of the things we're fighting as dentists is the fact that a lot of people go to spas. There are lots of spas advertising whitening, and they're not telling people the implication. Because
Can that really happen, that your teeth are whitened?
yes, your teeth can be whitened.
Using what?
There are chemicals that are used, including hydrogen peroxide.
Ooh.
But there's a pro and there's a con. Whitening can increase sensitivity, which is another problem entirely.
What are the, just for, we have just about 5 minutes.
Okay.
What are some of the conditions that can be linked to oral health?
Wow, one that is very common. I'm going to talk about two. Heart health. I mean, cardiac, yeah.
Oh.
There's some bacteria in the mouth that when we see it is an indication of a heart problem that is linked with heart problem. When you have some kind of like valvular heart disease, it is one of the things that when you come into the dentist, you need to tell your dentist, because even something as simple as cleaning your teeth can be life-threatening.
Wow.
Diabetes. A lot of people have been diagnosed in the dental clinic because your oral, the gum health is shown. When people are diabetic, their gum health is one of the indications of that. And when it's been linked, if you don't have a good gum health, it has been linked with diabetes, and heart disease. So those are the two things, very key.
What can we then do? Let's talk about some to-dos for people now.
Okay.
You know, what can people do to improve their dental or oral hygiene?
Well, first and foremost, I think if you've never, I've seen Nigerians that they're in their 50s, 60s, and say, I've never been to a dentist. Please go to your dentist. Let them even examine you. Let them know, is there a problem? Once you know that there is a problem, are you brushing right? I mean, get it correct. So that, okay, if I have a problem, if I have a feeling, I remember even as a child, for me, I visited the dentist a lot. But my first experiences with the dentist was to have my teeth extracted. But over the years, by the time I got into the university and I went to see a dentist, and I had to do some fillings. He did those fillings, and those are since then, I've not had to do any more fillings. I've not had to remove any tooth, because he did those fillings at that time, and we're talking of over 30 years ago. So first, going to your dentist, what if I have a problem? Let me solve the problem first. I know that a lot of times people think about the cost, but at least preventive, that, okay, let me go. Let me know what the problem is. Well, I know that we do a lot of programs where they are free, universities, they are free programs, and say, come for dental examination. Know what the problem is. If you have a problem, you might not have a problem. You might not have a problem. Know if there's a problem, know the solution, learn how to, the techniques, the brushing techniques that will work for you. Because what might work for Mr. A, because of the shape of his teeth, might not work for Mrs. B.
How about nutrition? Thankfully, you're also a nutrition coach. So
Yes.
how do both work together? How do people improve their dental health or oral health through nutrition?
Okay, that is a very good question. Now, processed carbs is not a good thing for your oral health. But when you do eat it, when you do eat the bread, the Why don't you end it up with chewing a carrot, for example? You know, the funny thing is
Do
chewing.
those go together?
No, it doesn't matter about it going together.
Okay.
Why are you chewing the carrot? You're chewing the carrot so that because carrot or fruit, they naturally clean the teeth.
Okay.
So when you chewing actually cleans the teeth. So if you chew only with your right side, your left side will be very dirty. When you come in, we can always tell where you're chewing with because one side is cleaner than the other. So chewing things like carrots. Or you finish eating, you finish drinking the soda, swish your mouth with water. So that, why? Because we want saliva to flow and bring the pH of the mouth back to. Now, processed carbs, sodas, they're acidic. And when there's acid and bacteria, that's when it softens the teeth. The enamel is the hardest structure in the body. It's actually stronger than our bones. But once there's bacteria, there's carbohydrates, they form acid. And acid will leach the enamel and make it soft. And then that's where the holes come in.
And for those who have sensitive teeth?
For those who have sensitive teeth...
Why do they have sensitive teeth?
Because their teeth has been leached out over the years.
Speak English, please.
When I say leached, it's the acid has worked on it, so it doesn't have, like that. When I said things like fluoride.
Okay.
That's why the toothpaste for sensitive teeth, because they have a higher fluoride that will help remineralize the teeth, because the minerals in the teeth have been removed over the years, so the teeth is now sensitive.
Well, well, well. There's still plenty to learn about this mouth of ours.
Yes.
You know, and it brings to my mind that radio commercial. Something. How does it fight cavities? Does it use kung fu? I think that brought home the point.
Yes.
You know. Thank you very much, Dr. Abimbola Odushote, dental surgeon and General Secretary, Association of Private Dental Practitioners in Nigeria, and also a certified nutrition coach.
Thank you very much. Thank
for coming to tell us how to care for our teeth.
And not have mouth odor.
Thank you.
Thank you.
We shall now have the home stretch
with Shim.
ṣé ọ̀rọ̀ tinú ló máa ṣe láṣẹ wa. dáàdi mo ń lọ mo sùn.